I guess one on either side, if you want. Yeah.
Sure.
And we can. You guys let us know when you're ready. Okay. Well, thank you for joining us. I'm delighted to have with me today our union leadership from both CUPE and Allied Health. We are announcing today similar initiatives to what we've announced for other bargaining units in the province for retention of our public sector employees within the healthcare system, where we understand there are significant, for the disciplines where there are significant retention challenges. So these initiatives today, I believe, will go a long way for the membership of both CUPE and Allied Health to ensuring that we retain these employees with a return in service for the retention bonus as we continue to look to recruit our healthcare professionals, not only from other areas of Canada, but from outside of Canada as well. With that, I will invite members of both Allied Health and CUPE to speak, and then we'll open it up for questions. So who wants to go first?
Well, thank you for that, Minister. And this has been a long waiting process of making our announcement on the recruitment and retention issues with our healthcare professionals. And we thank government for taking this initiative to do it. As any good union leader in the province will always say, it doesn't go far enough, but we'll continue working on that. But it is great for us, for our healthcare professionals and our licensed practical nurses and personal care attendants and paramedics that has been really affected by all the recruitment and retention issues here in the province of Newfoundland and Labrador. And again, thank you.
I as well would like to thank Minister Osborne. We've been working on this initiative for quite a while, and I'm really glad to see that we're able to move this forward today. This is a really good first step, but I really feel like we need to deal with the crises that are in front of us. We also need to get maybe a little bit better and work a little bit better in partnership in anticipating what's coming around the turn at us. We know we've got succession planning issues with health professionals. We know we got anticipated retirements. Public sector and private practice is always a threat to our members inside the public service. So there's a lot of moving parts here. I'll use a quick example, and today is Genetic Counselor Awareness Day, so it's kind of interesting that we're doing this on this day. We have a membership there of about 10 members, 10 funded positions, currently have 2 vacant positions. So that loosely turns into a 20% vacancy rate, and even when you have 2 people gone in a small discipline like that, it creates work and wait list and creates access issues for the public in getting to those services that they need. So this is a really great first start. Really glad to work with the Minister and his team in partnership with this. And I know we're all going to continue to work. We all have a role here, and we're all going to work really hard to keep this moving forward so that the services that the province needs, the residents of the province need, are going to be there for them.
Happy to open it to questions for either myself or Gordon or Sherry.
I guess to start, I was still here. What's the biggest piece of information that's announced for you, whether it's retention bonuses, overtime, or licensing?
Well, for us in the healthcare profession, just bringing back some retirees with the license, it's a sign of promise that recruitment could get better in the province of Newfoundland and Labrador. And the overtime rate is what our members have also asked us to do, because when you're working sometimes a 24-hour shift on mandation, the double overtime rate right now, they would only get time and a half on a mandation shift. So with this new wording, they would actually get double time on mandation of a shift. So it means a lot to our membership for sure.
Have you seen much interest from retirees to come back?
We've seen a few, not as many as we anticipated, but hopefully now that CUPE actually is making the official notice, we may get more retiree CUPE licensed practical nurses and paramedics and personal care attendants back in the system, for sure.
Outside of those jobs, are there any other types of jobs that you represent?
We represent physio, therapist aides, rehab aides, health OR techs in Western. It's almost too many for me to mention them all because I would neglect some of them. So absolutely, we are seeing shortages. Our healthcare professionals certainly do not have a work-life balance. I know the Registered Nurses Union has done a lot of work on recruitment and retention, but it's not just the registered nurses. It is our nurses as well, our licensed practical nurses especially. They have been worked beyond. We started sounding the alarm long before COVID happened. We did it in Bay St. George long-term care facility in Stephenville Crossing on the shortage of licensed practical nurses, and that's over 4 years ago. So there was problems back 4 years ago.
You mentioned in the press release, it says CUPE has developed additional proposals for the government to help attract and retain. What are those additional proposals?
Yeah, thank you for that question. But yeah, so not all of our members are represented under this recruitment retention issues. So there's things that are on our bargaining proposals that I'm not willing to talk about today, of course, because we are at the bargaining table right now, and there are issues that are on the table, and we'll discuss them on at the bargaining table. That is happening as we speak.
Well, for us, some of the big thing right now for us today is the retention piece. Our members are always, there's always that piece of them being attracted to other areas to work. They have skill sets that are in high demand. Right now we're facing a 40%, maybe even a little higher, 40% vacancy rate in clinical psychology. It's impacting the mental health program, it's impacting pediatrics. It's just, at one point last year we were losing a psychologist a week. So anything that helps us retain the group that we currently have and maybe even bring some back would be really, really positive for us. We certainly want to stop the bleed. Our respiratory therapy group is another group. They're beyond exhausted. I talked to some of you in the media during the course of the pandemic about what was happening with that group. It was, after all, a respiratory pandemic, and they were exhausted. They're still exhausted, and we know there's being sought after. So we got to keep these people here. We got to keep them in the health centers. We also got to look at things. I'll just make a really quick reference. I worked a few years on the Burin Peninsula, and Burin Peninsula historically has a really good history of bringing their homegrown talent home. So people who've went away, trained as physiotherapists, things like that, and brought their skill sets home, worked in those hospitals, worked in those communities. There's a lot of really good, strong, seasoned people down there working, but they're also creeping close to retirement. So when I talk about anticipating those needs coming, we've got to start thinking about that. What are we going to do when that group starts retiring out of the system? People who are offering specialty services in our bargaining unit, same thing applies. We have people doing assessments. There are probably only 1 or 2 people in the province skilled to do that piece of work. If they retire, or if they're brought into another area, or lured into the private sector of some sort, we're going to lose that skill set. That's a problem. This is a good first start. I think what we need to do is look at some longer term pieces and building on this. So hopefully, again, I'm looking at this as a bit of a stop the losing of staff, but also really looking at some of the things, and even some of the things Sherry mentioned as well, work-life balance. We know that a lot of our members feel like work is consuming their lives. And outside of being a healthcare worker, a lot of these people are parents, they're partners. They want to have a life outside of this. We have some people in rural areas, some of our members, who are almost doing 24/7 continuous coverage. I'll make that reference to some of our rural sites. When you've got 1- and 2-person departments, and some of the small hospitals in the rural communities, that's what we have. 1- and 2-person respiratory therapy departments or physio departments. They're small, and again, you have a 2-person department and you lose 1 staff, you've just doubled the other physiotherapist workload. So it is a concern and something I'm hoping we're going to work together in partnership to get better at.
I guess also, is there any plans to look at more long-term solutions?
Absolutely. I value the relationship that I have with Gordon and Sherry and Jerry and Yvette. So we working together, there are challenges, and none of these challenges are easy to resolve. I think we'll all agree to that. But we have to continue working together and try and resolve some of the retention issues. And, I've said many times in the media, in the legislature, and in public, that the province has to do a better job of recruitment. As both Sherry and Gordon had said, in anticipation of retirement, succession planning, these types of things, looking at recruitment. So we've brought in the Medical Act, which allows us to better recruit from outside of Canada. We've worked with the colleges of nursing, both the registered nurse and practical nursing colleges, to lower some of the barriers. We continue, in fact, I've got a meeting again today with one of the colleges to lower some of the barriers to recruitment from outside of Canada, internationally educated nurses, for example. We've worked well with the College of Physicians and Surgeons to lower some of the barriers. The colleges have been very good partners with us. Over the past couple of months, we've had many meetings and looking at ways that we can make it easier to bring our healthcare professionals in from outside of Canada. We just announced a very dedicated nursing recruitment drive in Bangalore. We will be announcing in the very near future a very dedicated physician drive. We're looking at in Bangalore, it's both RN and practical nurses, so it is a nursing drive. We're looking at a practical nursing drive in another location as well, and we will continue working with the colleges, in consultation with our unions on every way that we can recruit and retain. This is a very critical area, not only for this province, for every province in Canada and globally. And we have to be better than other provinces at recruitment, and that's what I'm driving to do. It's one of the biggest issues facing our healthcare system today, is needing to get additional healthcare professionals to lighten the load of the healthcare professionals we have within the system who are overworked, working double time, mandated shifts. So these announcements today add to the recognition to help with retention, but retention and recruitment are things that we're focused on getting better at.
I'll just quickly add on to the ministers, just that whole piece around out of province. Inside of our membership, we have a lot of people, a lot of our disciplines are trained outside of the province. So physiotherapy, occupational therapy, speech pathology. We have to get those people out of the province to train them. Then we have to bring them back. So if I'm a young grade 12 student from Bonavista who wants to go and become a physiotherapist, we're looking at that person. They probably end up in Halifax, or they end up wherever they can get accepted to do their physio degree. But then, at times you're competing with big cities. They met a partner while they were up there in university or what have you, and then we're trying to bring them back. I think we got to try to look at some things around how do we connect with those people, even while they're training, while they're doing that program in another province, and really trying to get them in a place where, you know what, we want you to come home, we want you to be home. and there's opportunities for you. Because when you get to push them out and then bring them back, there is a new challenge there, because sometimes big cities, different things might be attractive to them, and you're trying to build that out. So that's one thing I'm really hopeful that we're going to do some work around as well, to really try to look at that piece around getting people here and getting them home and them wanting to be home with us, living in these communities and contributing.
Thank you, everybody.
Thank you.
Thank you again.
Thank you again. So where are you going?